Relationship-based care, in my opinion, puts people into this healthcare system.
The patient's needs are not being met. We're not doing our job.
Patients tell us that they consider a healing environment to be one where they have a relationship with their caregiver and they are involved in making decisions in their own care. And I think that's really the essence of relationship-based care.
Relationship-based care for the caregivers at Texas Health Center for Diagnostics and Surgery obviously means many things, but one main ingredient in their success is doing whatever it takes to relieve patients' fears. Essie Solis sings to her patients.
If somebody's stressed about an IV, we go in together as a group and we try to get them not to think about that. So one nurse is over here trying to attempt to do the IV, and the other nurse is on the other side of the bed singing, dancing, whatever it is. And so the patient's like, wow, I've never had this service before, I want this again.
Ogana Azubike defends hers.
We should always think about if we were out, if we were on the other side of the equation, will somebody stand up for us and make sure that things are done right for us? And I'm so particular about that, and I always speak up for my patient, even if it means going head-to-head with a doctor. I will stand up for my patients, and I'm very proud to say that.
Chief Nursing Officer Ellen Baldwin teaches the power of sitting down.
To have your caregiver come in at the beginning of the shift and actually sit down in a chair to talk to you instead of standing up over you looking down at you creates a whole different experience. It makes the patient realize that you do have a genuine interest in them and that you have time for them. You have time to listen to what they need to say.
Cheryl Kennedy's commitment isn't measured even by a time clock.
We'll also remind them that we'll also be calling you a couple of days after you go home just to see how you're doing, but here's our number, call us 24/7.
The nurses here are excellent. They take good care of our patients. My wife was a patient here, and she was very happy with the care she received with the nurses here in the operating room as well as over on the floor across the way. And I would never hesitate to send any other family member here as a patient either. Certainly I bring my patients here because I believe in the hospital.
And if I was in that bed, what would I want to be asking? What would I want to know? And what would I, more importantly, want somebody to tell me? And tell me in terms that I can understand.
But relationship-based care also means THCDS employees caring for each other.
I think it's a really, really great place to work. Besides your duties, besides everything else, that they see the employee not just as an employee, but as a part of a family.
Particularly in my field of work, you have to give, you have to be productive and give something to someone every day.
We consider all of our employees, whether they're nurses, whether they work in the business office, whether they work in housekeeping, they're all considered to be caregivers.
It's different here because everybody's friendly here, have an awesome staff, the culture's great, they've created an awesome culture here. It's different than a lot of other healthcare facilities.
Relationship-based care is, simply put, self-explanatory.
That's how we make a difference. That's how we set ourselves apart from others, I believe, is that it's the relationship. It's all about the relationship.